Can you see me?
Yep. Okay. Right. So, welcome to Way to Paces. I've just done the scenario, and thank you, Dr. Shaheen, to be the candidate. So, you are the doctor on the medical ward. I'll give you 3 minutes, Dr. Shaheen. Mrs. Alice Horner was admitted from home 4 weeks ago with vomiting and weight loss. Blood tests were unremarkable. Endoscopy showed mild gastritis and CT scan of abdomen was reported as normal. She is taking lansoprazole and her vomiting settled. She was diagnosed with dementia 3 years ago and her dementia is now very advanced. She is bedbound and despite help she neither knows how to eat nor shows any interest in eating. She only takes small amounts of fluid. She is not in any way distressed. The medical team feel that further aggressive therapy and investigation are not appropriate and that palliative care is the best approach. Mrs. Alice's daughter, who is Mrs. Lissy, would like to speak to you. Your task is to speak to Mrs. Lissy and discuss any issue arises.
Sir, can you please share the scenario again, please? Sir, I was DC. Please share the scenario, sir, in the chat box. Hello.
Hello.
Yes, sir. Please share the scenario in the
Yes, sir.
chat
Please
box.
share the scenario in the chat box.
I did. Okay.
As I didn't read, I was discharged, sir. It was, sir, hello. Can you hear me?
Sir. It was, sir, hello.
Hello.
I can't, sir. My voice is echoing too much, sir.
Can you hear me? Sir.
Okay. The scenario, are you sharing, sir?
Sure, it's not some issue. It's not getting it. So,
Hello, sir.
right. I will share.
Hello, sir.
Yeah. Give me a few minutes. There's some problem there. Right. I would share you separately
Sir, I saw
in
now.
WhatsApp. There's some problem in the Zoom. It's not letting me to share here.
So please
And
give me.
while you do this scenario, I've shared in Zoom chat now. Right. Are you there, Dr. Rahim?
Yes, sir. Just give me 2 minutes.
Right. Do you want to start now?
Just give. Yes, sir. So can we start?
Yes, start.
Hello, good morning.
Hello, good morning.
Hello.
I'm Dr. Baik, one of the doctors in the clinic. May I confirm
I'm
your
Dr. Baik, one of the doctors in the clinic. May I confirm your
sir? My voice is echoing too much. Hello.
sir? Hello.
May I
Hello, I
confirm?
can't hear your voice.
May
Tell me again.
I confirm?
I can't hear your voice. Tell me again.
Sir, actually, my voice is echoing a lot and it's disturbing me, sir.
Telling me, sir.
Still now, sir. Whatever I'm saying, it's again repeating, sir. Anyways, I can try again, okay? Hello, good evening. Sir, can you hear? Good evening.
Hello, good evening.
Hello.
I'm
Can you
Dr.
hear?
Baik,
Good
one of
evening.
the doctors in the
Yeah, I
clinic.
can hear you. Yeah, go on.
I'm Dr. Baik, one of the
I'm
doctors.
Dr. Baik, one of the doctors
Confirm
in the
your
clinic.
Miss Lisi,
Hello.
daughter of
I'm Dr. Baik, one of the doctors. Confirm your Miss Lisi, daughter of Mrs.
Yeah, I am.
we are here today to discuss about your mother's
We are here today to
condition.
discuss about your mother's condition.
Yep.
Do you want anyone else to
Do
attend
you want
our
anyone
meeting?
else to attend our meeting?
No.
Well, may I know how much you know about your mother's condition?
Well, may I know how much you know about
Her, because so even though I was out for a while in terms of I got married and then I got broke up and now I'm living with my mom for nearly 4 weeks now. I'm living with her, so I know more about her. She has a dementia, I know that, and then she went to hospital with sickness and about the weight loss. So I think after that, I think they did some tests. I'm not sure about the full results of the test and things, but they say me the sickness is settled now. But I'm more concerned about the weight loss.
Yes, it must be very worrying for you. Actually,
Yes,
your
it
mom
must be
came
very worrying for you. Actually, your
4 weeks
mom came
back with severe
4
weight
weeks
loss
back
and
with
vomiting. We
severe
did
weight
some
loss.
blood tests and we did some scans, imaging, and camera tests, but they were not very much remarkable. And we put her on some medicines for her vomiting, which has been settled now. But as you know, your mom has been suffering since 3 years, and her dementia. May I explain what is dementia?
I know what's dementia because I've seen people, let's say my grandmom and unfortunately my granddad. I've seen people with dementia. I know about dementia, but what's happening to my mom? I'm more concerned about what's happening to my mom.
Yes,
Yes,
actually, she
actually,
has
she has
now
now
progressed to
progressed to
early
early
end stage
end
of
stage
dementia, which is
of
an
dementia,
irreversible loss to the
the
brain
brain
cells,
cells,
due to
due to
which
which
she
she
is
is
not
not
able to
able to
eat
eat
anything.
anything.
This
This
is
is
the
the
problem
problem
which is
which is
causing
causing
weight
weight
loss,
loss,
and
and
she's
she
now
is
in
now
a
in
very
a very
irreversible
irreversible
stage.
stage.
I'm
I'm
sorry to
sorry
tell
to
you
tell
this
you this
news,
news,
but
but
anything is
anything
not
is not
helping her
helping her
now,
now,
and even a small
and
amount of
even
fluids
a
she can
small
hardly take. You are aware of that, right?
can hardly take. You are aware of that,
Hello.
right?
I know because I don't know when you say because you said
Hello.
everything in a I don't know what do you mean by what do you mean by irreversible? What do you mean by irreversible?
Yes, dementia actually is a
Yes,
condition in which the
dementia
brain
actually is a
cells,
condition
once
in which
damaged,
the
they are not
brain
recovered.
cells, once damaged, they are not recovered.
Okay, but what that
Yes,
mean to my mom?
and
You're talking about
yeah, in
dementia.
your
You're not talking about my
And
mom.
yeah, in your
yes, it is in your
yes,
mom's case.
it is in your
This
mom's case.
condition,
This
dementia,
condition,
has been
dementia.
so advanced that it causes progressive loss of all the body functions, the movements, including the swallowing, speech, the feeding, everything. It has affected in your mom case, and because of this, she is unable to take anything from the mouth. It has slowly, it has worsened to such a stage that nothing she can take nothing from mouth. So that's why in her case, the consultant has decided that any intervention would be not fruitful, and we will keep her for this palliative care. Are you aware of that?
No, again, I am not very clear because you told everything in a row. So, what do you mean by any intervention? What do you mean by that?
Yes, a medical
Yes,
team
a
of
medical
consultant has
team of
decided that
consultant has
any
decided that
intervention, like any instrumentation or any machine, she would not be suitable in her
in her
case.
case,
It
it
because already her
because
disease
already her
has been
disease
advanced
has
at a very serious stage, and now she is not able to cope up with this. Even the feeding also is a problem. So we have decided that palliative care will be the best approach. May I explain you more about this palliative care if you wish?
if you wish.
I'm still not clear about when you say intervention, instrumentation. What are those? What are we talking about?
Like if
Like
whenever
if
person
whenever person
is
is
breathing or
breathing
has a
or
problem
has
in
a
breathing
problem in
or
breathing
pumping
or
activity of
pumping
heart,
activity of heart,
we put
we
them
put
on some
them on
machines
some
to carry
machines
out
to
the
carry out
vital
the vital
organs
organs
active.
active.
Like
Like
the heart and the lungs, they are very important to carry out the vital or to carry out all the activities. But in your mom's case, these machines will not be suitable.
So, why are
If
we
we will
talking
take
about this now? So, I'm just asking in terms of why her weight is going down, and you told about yes, everything is going down, but why are we talking about the machine? And I can't understand. Is there any problem with the heart now?
Yeah,
yeah,
because
because
now
now
her
her
condition
condition
has
has
progressed to a very advanced stage of the dementia, and in her case, the team of the consultant has decided that the best approach will be palliative. I think you don't know about the
the
palliative.
palliative.
May I explain you
Explain you
more?
more.
What do you do? What do you do in palliative means what? So,
In
how are
palliative,
we how are we going to address her feeding if she's not taking anything by mouth? She'll go down, isn't it? And in fact, I would say when people won't take anything, they'll die. So, what is going on?
yes, I appreciate your concern. Actually, your mother is under close observation. We are continuously monitoring her. We will not leave her alone. Palliative care means that when a person's the body organs like heart and lungs are not functioning, or any serious illness which is which is in the advanced stage, and further investigations and further machine putting on machine will not be suitable for the patient. So we put him on palliative care. In this care, we will take care of all the nutrients, the fluids which the patient body needs. We will provide them with all the hydration, and keeping him away from any pain. If he has developed any pain, we give painkillers, and we might include any antibiotics if needed for infection, or if the person has some problem, we can go for other treatments like chemo or radiotherapy. But instrumentation, I mean like machines, the breathing machines or any major surgeries or any instruments, they are not included, and that will not be provided. But overall, the patient care will be taken. We will closely follow your mother, and we will monitor her or every time we will look into the input and output, whatever fluids she's taking. We will provide her all the nutrients, and we will
We will
keep her
keep her.
pain free, so that she passes her last days of life free without any pain and in peace.
So, what do you mean by keep the nutrients and fluids? Are you going to give her like a feeding or a drip or anything like that?
Well,
I highly acknowledge your concern. Actually, your mom has developed dementia, in which case the person has lost her the mental capacity to decide or anything. She can pull out the tube if we put by mouth. There are two options that we can either put the tube by mouth or through the tummy directly, which is called PEG tube. Have you heard of it?
Yeah, I know. That's what I'm asking in terms of
Yes,
what. Say, you only said, isn't it? You take care of the nutrients. So, if you're not going to do any feeding or anything, how are you going to take care of the nutrients and hydration?
yes, we
yes,
will
we
give
will
her
give her
all the
all the
fluids
fluids
and all
and
the
all the
nutrients
nutrients
through a
through a
tube which is called as PEG
PEG
tube.
tube.
It will
It
be a
will be a
small
small
needle
needle
going
going
inside the
inside the
skin of
skin
the
of the
tummy,
tummy,
and we
and
will
we will
connect
connect
it
it
the
the
tube,
tube,
and
and
we will
we will
pass
pass
all the
all the
fluids
fluids
and the
and the
semi
semi
solids
solids
we will
we will
give her
give her
to
to
make her
make her
body
body
provide
provide
all the
all the
nutrients are needed, so that
so
she
that
is
she
not
is not.
deficient of any vitamins and minerals. But
But
from the
from the
mouth,
mouth,
it is
it is
not
not
suitable in her case, as she can might pull out from the mouth, and it can be more injurious in her case. Uh, and other than that, the peg tube, we will monitor her for all the any pain, if she has any pain or any infection, if she develops sores or anything like that. We will closely observe her, and we will provide all the care needed for this palliative
palliative.
care.
So are you going to give her a drip?
Well, it
Well, it
might be needed in her case if she is having a lack of fluids, as she is not taking anything by mouth for so many days. So if she is dehydrated and she requires fluids, we might need to give her through the blood channels.
Okay, so she's going to get the fluids by the drip, and she's going to have some other form of feeding. Is that right?
Yes,
yes,
some
some
sort,
sort,
yeah,
yeah,
feeding,
feeding,
soft
soft
feeding
feeding
through the
through the
tube.
tube.
Okay. Then what's palliative? Is it the feeding decided by palliative care team? Do they do the process, like what do they do? Do they do the feeding and things?
Yes,
Yes,
there is a
there is a
team of
team of
palliative care
care
team,
team
which
which
involves
involves
all the
all the.
palliative nurses, and there are many community nurses and the doctors involved, which will look after her. They will take care of all the nutrients and all the fluids, and they will also monitor for any infection. Like they will keep the mouth wet by closely monitoring for any sores in the mouth, or they will change the position of the patient to provide to prevent bed sores, and they will also manage for her bowel and bladder works.
How long we are talking about? Because it's going on for a long time. How long we are talking about?
I'm
I'm
sorry, but
sorry, but
it's
it's
very
very
difficult to
difficult.
answer how much time it will take, your mother will take, because it depends from patient to patient. And in your mother's case, the disease has quite advanced, as you know. So we might be talking about of some days or some months. I'm really sorry to tell you, but exact I can't tell you the time.
Can I take her home?
I think
I
it's
think it's
better if
better if
she is
she is
under
under
care of
care of
palliative
palliative
team
team
for
Two
some
for
minutes
some
days.
more.
days.
Yeah, for
Yeah, for
some
some
days
days
till her
till her
condition
condition
improves,
improves,
and then
and then
later,
later,
if
if
she is
she is
better,
better,
you can
you
take
can
her
take her
home,
home,
and you
and
can
you can
manage her
manage her
home
home
with the
with
help
the
of
help of
palliative
palliative
nurses
nurses
who will
who
look
will look
after her.
after her.
Okay. When you say manage, who will be doing the drip and all?
Pardon?
Pardon?
Who will be doing the drip, the fluids? Who will be doing the drips when she goes
Yes,
home?
Yes,
yeah.
yeah.
When
When
she's in
she's
the
in the palliative
under
under
palliative care,
palliative
the
care, the
nurses will
nurses will
guide you,
guide you,
and
and
they can
they can
teach you
teach you
how to
how
do
to do
this,
this,
and you
and
can
you
take
can
her
take her
home
home
after
after
some
some
days
days.
if she's
She's
better.
better.
And if you can take, and you can provide her all the fluids through the channels, which will be a tube, as I told you, on the tummy. But the
But the
nurses
nurse.
will visit her frequently to take care of any infection or any other requirement if she needs.
So I can do the drip at home.
They will teach you how to do it. Otherwise, if
Otherwise,
you
if you
can't,
can't,
then the
then the
nurses will
nurses will
come at
come
home,
at home,
and they
and
will
they
do
will
this
do this
all,
all
providing
providing
fluids
fluids
through the
through
drip.
the drip.
Right. Okay. Time is up. I'll give 1 minute to think about it. Doctors who are listening, so you can also think about the scenario and how the scenario went, what you would have done, anything different, and we will discuss at the end. Yeah, time is up. Examiner time starts now. So, how did the consultation go?
Sir, I
Sir, I
think I
think
could
I
have
could
done
have done
better
better
because of
because
the
of the
background
background
noise of
noise of
my
my
echo. It
echo.
was
It
like
was like
I was
I was
little bit
little bit
stressed.
stressed.
I could
Ex-
I
have
could have
told her
told her
more
more
clearly
clearly
the
the
palliative.
palliative.
Okay, so when you say more about palliative, what do you mean?
Like
I like
her
her
concern
concerns
about
about
who will
who
give
will give
her
her.
fluids at home. That I'm not sure that whether I answered correctly or not.
Okay, I'll remind you this is examiner question, so you have to be specific and answer.
Sir,
Sir,
okay.
okay.
I think
I
the
think the
scenario went okay, and the daughter was able to understand about palliative care. If I had time, I would have asked her more about her the patient's LPA or living wish. But as she's lacking capacity, so I think the daughter has the right to take decision on her behalf, being next of kin.
So, can next of kin make decisions on patient's behalf?
I
I
think
think
no.
no.
If
The
the LPA is the
LPA is the
person who
person
has
who
to
has
take
to take
decision.
decision.
But I
But I
didn't have
didn't have
time to
time.
ask if she was the LPA, like her mother has appointed her as a LPA.
Right. When you say about the machines, what are you talking about?
So
So
ventilator
ventilator
and
and
the
the
CPR,
CPR,
like any
any
instrumentation.
instrumentation.
Okay. What about pig feeding here? Did the scenario say she's okay for pig feeding?
So I
So
was
I
not
was not
sure
sure
about it
about it
because
because
NG,
NG,
I know
I
that
know that
dementia we
dementia we
can't
can't
put
put.
NG. But the other way to give her fluids is the PEG, I think.
But what did the scenario say?
So
So
I'm
I'm
reading the.
reading the
She's
she's
bed
bed
bound in
bound
the.
in the.
How to read. It's not
It's not
mentioned
mentioned
about
about
PEG,
it,
but it's
but it's
written that
written
she
that
is
she's
only
only
taking
taking.
out a small amount of fluid.
Okay. You won't get this sheet in front of the exam. It will be taken out as long as you're not making any notes. You can't go back in exam to read about all those things. The scenario says further aggressive therapy and investigation are not appropriate.
Yes, sir.
Yes, sir.
Palliative care
Palliative
is the
care is the
best
best
approach.
approach.
Okay. She said in terms of the drip, and you said people will teach you how to do it. Are you sure?
I was
I
not
was not
sure,
sure,
but
but
I
I
think that
think that
in the
in the
palliative
palliative
care
care
patients,
patients,
after
after
some days,
some days,
they can
they can
teach the
the
family
family
member to
member to
take
take
care of
care
the
of the
feeding tube.
feeding tube.
No,
The
she
peg.
she asked about drip. You are telling about feeding tube.
Yes, sir.
Yes, sir.
I
I
meant by
meant
the
by the
feeding
feeding
tube, I
tube.
meant
I
the
meant the
peg
peg
tube.
tube.
Yeah.
Yeah.
She asked
She
that
asked that
how will
how
I
will I
give her
give her
fluids at
fluids at
home?
home.
So I
So
thought
I
that
thought
peg
that peg
tube,
tube
the
the
nurse will
nurse will
teach.
teach.
Okay, what are the ethical issues here?
The
The
ethical
ethical
issue is
issue,
the
the
in this
in
case
this
the
case the
patient
patient
lacks
lacks
capacity,
capacity,
so the
so the
autonomy of
autonomy
the
of the
patient
patient
is
is
not
not
applicable. Beneficence that we are providing palliative care for the best interest of patient, and non-beneficence we will not do any aggressive therapy or any instrumentation for the patient's best interest, and justice we will treat her no matter regardless of her old age or race, gender, or politics.
Okay. You said about you will ask about the power of attorney. So let's say she doesn't have power of attorney. Then can she make decisions for the patient?
I think
I
in
think
that
in
case
that
the
case the
medical
medical
team
team
has
has
a right
a
to
right to
take
take
decision
decisions
in the
in the
patient's
patient's
best
best
interest.
interest.
So she can't make decisions.
Well,
Well,
we will
we will
ask
ask
her
her
decisions, but
decisions,
the
but the
medical team
medical team
has
has
superiority
superiority
over the
over the
decisions
decision
of the
the
patient.
patient.
Okay, time is up. Now, of the role of everything, I would say patient, surrogate, and examiner, everything off. Uh, I don't know. See, I would say it's it's not at all organized, and there's loads and loads of information from the beginning. I'm not sure whether you have assumed that patient knows about palliative care and things. So I don't think it's very appropriate to discuss about the machine and the lots of, let's say, jargon with the, when you say instrumentation and things. So that's why doctor is asking again and again. So why are you telling that? Why are you here? So tell me, what are the, how would you approach differently if you give
Yes,
another
yes.
chance?
I was disturbed by my own voice echoing, too much echo. Otherwise, I would have first of all asked her expectation
Expectation
about this
about this
meeting,
meeting,
her
her
ideas
ideas
about
about
dementia.
dementia.
Then I
Then
will
I will
briefly
briefly
explain
explain
about this
about this
dementia, that
dementia that
her
her
mother is
mother
in
is
her
in her
advanced
advanced
age, and she is unable to feed anything, and we will the team of doctors have decided that the palliative care will be best approach. So I won't talk in detail about the machines and all, because this is not the scenario. The scenario is about the palliative care. But the machine, when the she asked, the relative asked, then I explained her that the breathing
breathing
machine.
machine.
No, did you bring it up or did she ask? You are the first one to say, isn't it? In terms of,
I
I
told her
told
that
her
we
that
will
we
not
will not
put
put
her on
her
any
on any
machine.
machine.
so do you think there is a, see, before telling that, we need to check, isn't it? We need to check whether she is on the same pace. I think we
Right.
discussed before many times. So before telling anything patient we won't do it, we need to check whether patient or the surrogate can understand why we are saying it.
Right.
Right.
Have you ascertained that she knew about advanced dementia?
No, sir,
No, sir,
I would
I
have
would have
asked
asked
her
her
before that,
before that,
what do you
what do you
think
think
her mother's condition
condition
is
is
now,
now
and
and
how
how
she's
she's
coping
coping
now,
now?
and is she's not able to eat? So how do you think her condition is going nowadays? Like that, I would have asked the background.
Okay, I think that's the way. See, either you need to tell her what is advanced dementia will be like, or we need to ask her in terms of what is her view in terms of advanced dementia. So without telling about advanced dementia, so you can't immediately say I can't do this, I can't do this, I can't. That's a big list actually. You've told the big list, and I still I'm not sure what's the appropriateness in talking about machines first and then you're talking about machines, and then on the contrary you said palliative care, and then we will take care of the nutrient and hydration. They are both contradictory.
No, sir,
No, sir,
I
I
explained that we will
we will
not put
not
her
put
on
her
any
on any
machines,
machines,
but we
but
will
we will
put
put
her on
her on
palliative
palliative
care.
care.
When she
When
asked
she
me
asked
what
me what
machine,
machine,
so
so
that's
that's
why I
why I
explained
explained
Yeah,
how.
the scenario says clearly not for further aggressive therapy and investigation. So when you say aggressive therapy and investigation, would you class the pig feed as well as a therapy or not?
Yes, sir.
Yes, sir.
I think
I think
it's
it's
also a
also a
therapy.
therapy.
Yeah, and that's where I think you did go the other way around, because you talked about machines and things, but on the contrary, you said we'll do the peg feed. And when the surrogate asked about the drip and bag of fluids and things, you said, okay, yes, we'll do it. So that's the confusion here, because
So, sir,
you
PEG will
Peg will
also be
also be
included in the
included in the
therapy,
therapy,
aggressive
aggressive
therapy.
therapy.
no, see, you tell me, you tell me.
Then in
In
palliative, I
palliative,
think
I think
PEG can
peg
be
can be
included
No,
in the
pain.
therapy.
Pain is not an issue here, isn't it? So the issue here is not eating and taking only fluids. What to do next? See, just because that's what I'm still not clear in terms of, see. You need to go with the symptoms first of all. Just because we know how to explain palliative care, we can't tell the surrogate in detail about what is palliative care. Even though you know exceedingly well about palliative care, you need to go with that scenario. The scenario is about the fluids, and then how you support the patient in terms of, see, that's different. And what you are telling is about palliative care, keeping comfortable, and you would say we'll give injections and people will come. I have no clue actually, I would say. So I think you jumped from palliative care to the end of life care immediately. You completely jumped. That's what I would say. So, and that's where, as a surrogate, I was totally confused in terms of, see, the consultation or the communication skill is like a story building. So, you need to go, first of all, yes, dementia, yes, she is unwell, yes, she is deteriorating, and she is likely to deteriorate more from here. So, we need to keep it. So, first step is, we are not, you did tell about irreversible condition, and then you didn't say we need to keep her comfortable. That's the key word here. So you're not talking about cure, unfortunately, but things are going to get worse. Yes, things are irreversible, but at the same time, we need to keep her comfortable, not to put through in any investigation which is not going to really help her. So I didn't think you mentioned about keeping her comfortable. See,
I
after
told
seeing,
that we will see
Her
her
in.
sorry, tell me again.
yes, I
I
told her
told her
that
that
we will
we
meet
will
your
meet your
mother
mother
in
in
peace so
peace
that
so
she
that she
passes her
passes her
last
last
days
days
free
That's
of.
again, you're talking about last days, isn't it? We are not talking about last days here. So what you are telling is, see, you've got a, when somebody is in advanced stage, then you can talk about whether she is dying or not. See, what you are telling is, you expect the surrogate to read between your lines and then come to a conclusion, which the surrogate might not be. So we have to explain them step by step. We are not talking about imminently dying condition here, and that's where it's a, say, I didn't purposefully, I didn't make it like an angry situation, but easily surrogate could have been very, very angry in this situation.
So, sir,
So,
you
sir, you
mean that
mean
that
that
is
that is
end of
end of
life,
life,
which I
which
was
I was
explaining,
Yeah,
right?
explaining,
because
right?
last days of life you're talking about, isn't it? Last days of life. You said last days of life. That's a very powerful statement, and you are talking now to keep her without pain, and when the last days of life. That's it's completely confused. So you are expecting the surrogate to start the journey from here now, and then you moved her to until death.
Sir,
Sir,
3 years
years
of
of
advanced
advanced
dementia.
dementia.
So
So
I
I
think that
think that
it was
it
more
was
or
more
less
or less
end of
end of
life.
life.
That's why.
That's why.
But that's okay. But if you have to stick with your point, isn't it? And when I ask in terms of okay, how long we are talking about, you said days to months.
So that
So that
I was
I
not
was not
sure. So
sure.
please
So please
correct
See,
me.
correct
when
What
me.
you are
what
What
you
not
you answered?
sure, when you are not sure about whether days or months, how can you talk about last days of life? You have to be sure, isn't it? You have to be sure. If you see, when you are talking about people with the months prognosis, the plan is different. When you are talking about weeks prognosis, the plan is different. When you are talking about days prognosis, the plan is different. But when you yourself is not sure about days or months or weeks, and then you jump from one end to talking about pain-free last days of life, which is too much for the surrogate to take in.
So, sir,
So, sir,
reading the
reading the
case,
case,
I
I
thought that
thought that
he has
he has
like
like
maybe
maybe
weeks or months. What do you think, sir, when the surrogate asks how much time?
No, you
How to
can say
answer?
weeks. You can say weeks.
Yes, sir.
But
I
again, the
told that
sudden
maybe
deterioration can
weeks or
happen.
maybe.
It could be if she deteriorated suddenly, we will be expecting in days as well. See, that's what we are aiming to aiming to conclude
Sir,
here.
So
I
I
told her
told
that
her
it
that
may
it may
be
be
like
like
weeks
weeks
or
or
maybe
maybe
months.
months.
And so
And so
that's why
that's
I
why I
thought
thought
it is end of
end of
life
life
care
care
similar
similar
like.
like.
No, see, I wouldn't say. I personally don't think you can justify what you have done. Whatever you think, it's like, for example, you're talking about weeks prognosis means the plan is different, and then you moved from one end to the other end, which is too much for the surrogate to take in. It is too much for the surrogate to take all the information. So you yourself say that's what I'm again and again I'm telling. Communication skill station is like a storytelling. Step one, yes, tell about advanced disease. And then you have to check back again. What does she think? Has she understood what you have told? Then you need to check back palliative. Then has she understand? Then you need to check back in terms of you didn't ask her unfortunately what are her concerns in terms of question, isn't it? I was the one who is talking again and again in terms of okay, the feeding, what is going to happen, the fluid, this, that, everything. So I would say that a lot more things could have been done better than what things have been done already. So
And
I
sir,
don't know what.
regarding the
Regarding the
peg tube, please
Sorry?
please
correct me
correct
that.
me that
Peg
step
tube,
tube.
what will
What
be
will be
safe
safe
if he's
if
not
he's not
taking any?
taking any?
Sorry, ask me again.
So
So
regarding the
regarding the
feeding,
feeding,
Yep.
will
will
I
I
take the
take
peg
the
tube,
peg tube or
like
like
what is the
what is the
other
other
mode of
mode of
fluids?
No, no, it's the peg tube. It's not appropriate here, and that's what the medical team says clearly. So not for any intervention or investigation.
Okay, sir.
Okay, sir.
I
I
didn't know
didn't
that.
know that.
We will
We
say
will
that
say that
we will
we
give
will give
fluids through
fluids
the
through the
channels.
channels.
See again, see when you're talking about peg feed, how can you do fluids? And that's where you're a little bit confused about where you are actually. So you can tell, I can talk to the team and then come back on the peg feed because if the situation is not clear. So either you have to say peg feeding, we give fluids for the time being when we arrange peg feed, and then when we talk about peg feed, what will you do when she deteriorates? She
So
has
we will
already deteriorated now, isn't it? She is bedbound, not eating, and she is not distressed by not eating. And in terms of she is going down because of, you only said she is going down because of the every function of the body will go one by one. So in that case, if all these features is due to advanced dementia, not eating and going down, including the weight loss, if it's a part of the advanced dementia, how we are going to make it better by giving peg feed?
and then
And
sir,
then,
what
sir,
is the
what is the
alternative?
alternative?
There is no alternative. You have to tell that she is deteriorating. See why? That's the alternative is not to treat the symptoms and then see treat as a whole and to make her comfortable. And that's where the thing comes in terms of prognosis, deterioration, and to keep her comfortable, palliative.
So sir,
So,
what
sir, what
about
about
IV
IV
fluid and
and
rips?
rips
IV
was
fluids,
not
it's
asked?
not appropriate at all. See, it's not appropriate. When you send people home, you said like people will teach you to give fluids. That nobody will teach people to give IV fluids. IV fluids is only the medical team can give.
No, sir,
No, sir,
I
I
told that
told that
about the
about the
peg
peg
tube.
tube.
The
The
nurse will
nurse
see
will see
found
found,
yeah, in the
yeah, in the
fluid.
fluid.
You can't justify, isn't it? You can't justify. I talked about peg tube, but the surrogate might have asked about fluids.
Okay, sir.
Okay, sir.
So we
So
will
we
not
will not
give
give
her IV
her IV
fluids
fluids
also
also
in
in
this
this
case.
case.
See, again and again, I'm telling you, and also for the people who are seeing this, see, I am not saying to tell we won't give fluids, we won't give peg. It's not like that. So you need to build a story first, and you need to ascertain that this patient or her mum has advanced dementia. Once we set the scene, then you can go one by one. But try not to say at the beginning we won't give fluids, we won't give peg. That's not the suggestion I am telling you because you are putting me on the spot by asking only one question. I found it tricky when people ask exactly the question and expecting exactly the answer. It's not like that.
Yes,
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 sir.
sir.
Medicine is
I
not like that.
understand.
Communication skill is not like that. It's a continuation. If you ask one question, do we give IV fluids? If I say no means, so don't tell in the exam we won't give IV fluids. I'm not telling that.
Mm-hmm.
See,
So sir, we
always the
can
whole
tell that
scenario, sit in the scenario, go into the scenario and find out what the situation is. Then you come to a conclusion, then you ask. So, with me, when somebody is bedbound, advanced dementia, not eating and drinking, and going down, if the advanced dementia is the reason for a deterioration, I'd be thinking in terms of only weeks prognosis, maybe less, could be days anytime. If you are talking about weeks prognosis and could be less, I don't think peg feeding will be appropriate. I don't
right.
think
Right.
IV fluids will be appropriate.
Okay,
Okay,
sir.
sir.
Yes.
Yes.
So that is the conclusion. Not like if you take one thing, try not to ask and try not to analyze by asking only one question away from the scenario. Always link with the scenario. And I get another question from the chat whether PEG comes under intervention for nutrition as a mode of treatment for weight loss or palliative care. Again, but by now you would understand what I'm trying to tell. See,
Yes, sir.
nutrition is
We
important.
will
We will
consider
consider
overall
overall
condition
condition
of the
of the
patient,
patient,
Yeah.
and
and
this will
this
be
will be
decided by
decided
the
by the
team
team
depending
depending
upon her
upon her
impairment, her
impairment, her
condition.
condition.
Yeah. If you're not sure, you can tell that. But rather than telling we won't see, if you say you definitely do the peg feeding when you are not sure, that's tricky. You yourself said days to months. And when you see somebody within days, how can you refer them to peg feeding?
Hmm.
Okay,
So we
sir.
Okay, sir.
need to be clear in what we are talking about. Where is this scenario? Where is this patient? And then what prognosis are we talking about? The medical team is there. Say, you can always go back. When you say, for example, peg feeding is not appropriate, the surrogate says, I'm not convinced about it, then you can, okay, I'll go back and then ask my consultant and then come back. I'll ask my senior to talk to you. You can do that. But in this scenario, I don't know, the confusion is you yourself saying one end dying, no machines, everything, and the other end you say, I'll do the peg feed. And you say days to months prognosis. That's a total confusion in terms of where you are at.
So because with dementia, I thought that how to provide her nutrients. So NG is not suitable. The next option I thought is, but if
No,
the
so
patient
again,
is
it
really
doesn't
advanced,
matter.
then
It doesn't matter with the dementia. When people are deteriorating, see, and then you need to know about the dying process and deterioration. What is the how do people will be when they have got weak prognosis? Then you need to know that. Say, for example, this if I say with the cardiology, we all know it thoroughly in terms of what is like acute MI, and then what are the types of MI, what is expected in MI, how can you do PCI? Can you do PCI every time? You can't do. At one point, you will stop the intervention because you know more about things. We are confident and comfortable in saying we can't do the procedure at one point of time. But I would say we need to know more about the dying process, end of life, and what is PEG, what are the indications, and what are the contraindications, when do you consider, how do you assess prognosis. So everything I've done everything in free videos, how to assess in palliative care and dying patients and end of life. So I would suggest to go through the video and then you can have a basic understanding. Then once we understand the basic clearly, then we can relate the explanation to the patient or the surrogate. When we don't know what we are talking about, and that's what I feel like a surrogate, I feel exactly that you don't know what you're talking about because you are going here and there and confusion. So I won't be comfortable and I won't be impressed about your management plan explained to me.
Okay, sir. I will watch video. Can I
Can I
ask
ask
a
a
question
question?
for my
For my
knowledge?
knowledge.
I'll give you one sec. I'll give a chance to other people. So what do other people think? Any doubts or do you would have done something differently? What do people think? You can either text or talk. Okay. Any doubts or anything? No? That's fine. So that means everything is clear. Now you can ask your question. Yep.
Yes, so
Yes,
when
so
the
when the
surrogate
surrogate
asked
asked
that,
that,
can I
can I
manage her
manage
at
her at
home?
home?
What
What
are
are
the
the
criteria that
criteria
we
that
can
can
send her
send her
home,
home, or
and
and
he can
he can
manage
manage her
her at
her
home?
at home?
How
See
to
again,
explain
it's
them?
we need to ask in terms of say you need to ask first of all. Say how is she? So for example, she's bedbound, and then you need to know. You said like people will turn around with keeping bed sores, and also that means you need a hospital bed. So you need to talk about. So what is your home situation? So where they are, where how what sort of house they are living, and then bedbound means do they need any extra? They will need extra care, isn't it? So cares at home. Do you have any cares at the moment? So sending people home is not a single decision. Okay, hospital, home. You need to make a decision in terms of medically. I need to assess in terms of like a socially, in terms of cares and things. Then we need to come to a conclusion whether we can be managed at home. We're putting extra care and talking with the team. So here is the we need more again. The tricky thing is you are focusing only on the question, and then you need to go back and think about the bigger picture. So it is not a simple thing in terms of is yes or no. It's not like that. We need to dig in more in terms of sending people home is an important decision. So we need to make people safe, and also we need to provide the care needed before sending people home from hospital.
Right. So,
Right.
sir,
So,
in
sir,
this
in
case,
this
you
case, you
can
can
advise
advise
for
for
pies.
pies.
Like it
Like
is
it
a
is a
treatment.
treatment.
Nurses will come at home and look after her like that.
Yeah, the nurses won't come, the carers will come. See, the nurses will take care of the medical bit. If she's getting any injections or medicines or anything, nurses will give medication, but the carers will look after the cares.
Okay.
And then palliative care nurses or the specialist nurse. So there won't be any palliative care nurses 24/7 with the people.
Okay, sir.
Okay, any other questions before we close? Yeah,
Thank you,
Thank
sir.
you, sir.
I've got a hand raise. Yeah, Dr. Arulmoli.
Sir,
Sir,
actually, the
actually, the
patient has
patient has
advanced
advanced
dementia,
dementia,
but she
but
has
she has
been
been
intervened with
intervened with
endoscopy,
endoscopy,
which showing
showing
mild
mild
gastritis.
gastritis.
If
If
if if
if
the
the
daughter has
daughter has
raised
raised the
issue,
issue,
then
then
how we
how we
have to
have to
proceed?
proceed?
So when you say issue, is that like why endoscopy has been done?
No,
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 not like
not
that,
like
sir.
that, sir.
Suppose if
Suppose
we
if
are
we are
explaining,
explaining,
patient has
patient has
advanced
advanced
dementia,
dementia,
the
the
current
current
any
any
aggressive
aggressive
intervention
intervention
is not
not
useful.
useful.
Like that,
Like that,
if you are
if you are
explaining,
explaining,
Yeah.
and if
and if
the
the
daughter
daughter
raises the
raises the
question that
question
she
that
has
she has
been
been
investigated with
investigated with
invasive
invasive
investigation like
investigation like
endoscopy,
endoscopy,
then
then
how have we
how
to
we to
proceed?
approach that?
Right. Again, that's what I said in terms of chronology. See, the investigation with endoscopy is like 4 weeks ago when she got admitted to the hospital. So you
Okay.
know her for 4 weeks, how she is. 4 weeks ago, we don't know. It might be something reversible. See, what we are thinking here is she's not eating and vomiting. So we need to know why she's not eating, why she's having vomiting. The one of the check is okay, we can put the endoscopy and see if there is anything reversible reasons or not. Yes, we found gastritis and we're given lansoprazole, we treated. So that is a reversible condition without knowing what is happening. But now she is in the hospital for 4 full weeks, and you observed her for 4 weeks after the investigations and treatments. Still, she is not picking up. The vomiting has settled, but the eating and the other things have not picked up. Then you know the gastritis is not a problem at the moment. So that's been settled. But still, the bigger picture is the dementia. So that's how you come to a conclusion. It's not what to say, it's not appropriate to do the gastroscopy at the beginning because we don't know what we are dealing with, but we have done it. Still things are not getting better. It's just like giving antibiotic, and then the first antibiotic not get better, second antibiotic not getting better, and 4 weeks you have done different things, then you have to come to a conclusion nothing works, unfortunately. So in this case, initially we did the gastroscopy to find out what the problem is. Then we know gastritis. Then we tried to treat with lansoprazole, but things didn't improve from there drastically. In spite of treating, her eating didn't improve. Then you know the eating and the lack of appetite and her everything, a bedbound status is due to the dementia. At this point, it's not appropriate. 4 weeks ago, it was appropriate. At this point, it's not appropriate.
Okay,
Okay,
thank you,
thank
sir.
you.
Okay, that's how we need to get the and these are all the key points here actually. These are all the like the points to be remembered and then explained to the surrogate. Okay, right. Any more questions before we?
Are we doing next thing?
I need to check and then get back to you. So I would say, see, the palliative care, end of life care, and all the other situations, watch the videos again and again. So I've explained clearly in terms of what is palliative, what is end of life, how to deal with the palliative care, and then how to explain the end of life care, and how to stop any treatment, how not to start any treatment, like a withdrawing, withholding. So everything is in the Facebook video, or if you go to the website and put videos, click videos on that, it's there. So I would say please look at those and then get a clear understanding about what is going on. Then it's easy for us to explain the patient and the surrogate. Okay? Right. Thank you. There are no questions.